So we're back on. Gabby is here. I'm going to see if I can invite her. Here we go. Let's see how this gets. Okay, let y'all know this is a mini wellness series focusing on different wellness topics. Today we'll be talking about massage therapy and how you can include it in your self-care routine. I used to do it once a month, getting a massage, because I exercise a lot, and so these muscles cannot be so tense sometimes. So I'm gonna wait until Gabby gets on. She's a licensed massage therapist. She's gonna tell us about it and how we should include it and why it's important to have it. So I'm including it. Let's see, she's unable to join. How do we add people? Okay, we're doing it. Oh, this is not that easy, is it? Oh, there she is. Oh, how do you get in there? Oh. Okay, she's on. But now I have to figure out how to include her. This is sad. Oh, man. Okay. I have to join. Let's see how we can do this. Gabby. She's unable to join. Just tested this, so it should work. Nope. Okay, I'm gonna try this again. Here we go. She joined already. Oh, there it is.
Oh, man.
No, let me press pause on this. Oh man. It's going well. I'm pretty sure you're busy. It's okay.
Oh my God. How are you?
I'm good. Everyone, this is the first time I'm meeting Gabby. I'm excited to talk to her about massage therapy. And I know you had a busy day. Because I know like 6 o'clock is one of the rush hour times. So lots going on.
It's like, the way the school schedule, and then this week is the first week of school, and I thought I had it down. I was like, no, I'll be fine by Thursday.
No. You know what's crazy though? The first thing that popped in my head was, it has to be child related. Because I think that's the first thing that came to mind. I was like, it had to. It's the only thing. A mama will be there for her child. So I was like,
I'm supposed to be doing something. I really got it.
So I'm happy you made it. Gabby, not this Gabby, everyone, but Gabby, my friend. She's like, this awesome lady I know. She's amazing. You should interview her. I was like, who? When she said Gabby, I was like, you mean Gabby the Holy Spirit? Because Joel and Gabby sitting here. So I was like, no. She's like, my friend Gabby. I was like, okay. And I was like, I wanted to interview a Black woman who is a licensed massage therapist, and you are that person. So I'm gonna get it started. I know you have like a 7:30 appointment. So okay.
Yeah. Like, oh gosh, I forgot I had that too. Oh my goodness.
Yeah, girl, you busy, which is blessed, but favored, kingdom favored. So can you tell everyone about your practice and how they can reach you?
Okay, yeah, my practice in West Ashley. I do something a little different from what most people would consider like normal massage. Mine is more medicinal. I started working with a chiropractor in about 2013 and then branched off and started my own practice in, I want to say 2017. So now I've been working on my own for about 4 years. So I've seen a lot of different injuries and a lot of different bodies. But yeah, but watching people be able to change the way they their posture and to just change their quality of life is really like it's really rewarding.
Yeah, that's pretty cool. I wanted to leave this question till the end, but I have lower back pain, so I'll talk to you about that later when I work out. So I read your website and you had left the corporate world to do this. Can you tell us about that story? Because that's a level of faith
Uh,
there to just
it was
leave.
it was kind of like I was forced to
Oh,
do it at the time. I lost my job and I was just like, I can't do it anymore. I had a lot of anxiety. I worked at a call center and I think like we all hate like calling into the call center, but imagine being the person on the other side of the phone who doesn't want to be there either. And I
mm-hmm.
don't want to tell you that this company is full of crap and they're basically ripping you off. I'm trying really hard not to say that. Like,
But
so it was really stressful. So to be able to do something that I really liked to do, and I find it very interesting. I'm a bit of a nerd, which is why I'm always studying and trying to find like new ways to heal and change different types of postures. So
yeah. And then I also read that your son,
hello, you said my son
you
what?
said, I think on the website, it said your son was, you used massage therapy on your son. Well, not you, but the doctors
Yes.
did.
So when he was first born, he was at risk for cerebral palsy. So there was like scarring when he was born, which caused him to have. So what cerebral palsy is the you're not able to use your gross motor skills as well as most people. So people who have cerebral palsy might have trouble walking or using their arms. There's like really stiff arms or really stiff legs or really loose arms or really loose legs. There's just like a spectrum for that. So he was at risk for that. But we worked with a group in South Carolina. It's called BabyNet. And what they do is they have all these trained professionals who come into your home and work with you for free. And I was like, oh my
Mm-hmm.
gosh, it's free because like of course like struggling at the time. I was elated.
That's nice.
And but they tell you and show you exactly and explain to you everything and show you what you do with your baby and you just do those things. So at first his legs were super stiff and so I had to massage him. So she was like, yeah, just massage him every time you change his diaper. And that's what we did. And it worked. And I was just like, okay. And then we did physical therapy and that worked. And we were just like, oh my gosh, just like, why
Just
isn't
by
anybody doing
touching the
this?
body and the muscles.
Yeah, just by touching. So yeah, so again, both spectrums, his legs were super tight. So he wasn't able to do like the walkers and stuff like that. We had to like keep his legs pretty loose. Um, but yeah, having that news that like your kid might not walk and they may need braces to walk is really just like,
Mm-hmm.
but to be able to have like that help from a massage therapist, from a professional physical therapist, and them being able to set up a plan that I can do on my own that's inexpensive and I don't have to
Yeah.
rely on surgeries or any type of crazy medication was, really like hopeful. It's not always something so severe to
Yeah.
correct something that can be like so detrimental to your quality of life. So, yeah.
That's awesome because usually they want to solve the answer with medicine. That's what they know. But the fact that
Right.
you literally was touching him and massaging
Yes.
his muscles to repair whatever issue there was, that's pretty cool. That's why I like massage therapy. Ah, pretty fun. Okay, let's see. Okay, so another question I asked is, so how can people incorporate massage therapy into their self-care routine? So I usually do it once a month, but I haven't been doing it because I exercise a lot and I've been just lazy and busy. But how can people incorporate it into their self-care routine?
So, what I would say is start by massaging yourself first. Don't worry about, I think a lot of people are like, oh, I need to go get a massage and I don't feel like paying and I don't feel like going there. It's my day off or whatever it may be. I prefer to let someone else massage me because I can promise you, as a professional massage therapist, I don't even know sometimes what's causing whatever issue. Sometimes it's something they actually teach you that. Like when you're taking this notes, one of the sections is what they said, what you saw, assessment, and then the
Mhm.
plan. Because yeah, so that's kind of like a miss. So it's really good to go in. I would say I get massage like once every 2 weeks, sometimes once a week, depending on the
Oh,
time of
wow.
year.
Yeah.
But I work basically do a lot of work all day. Most people I would say about once a month, and that's a maintenance type schedule. Some people I see they can go every 3 months. Some people can go every 6 months. It really depends on the body and the type of work you're doing and the person, but really just incorporate little things that you can do while you're at home to yourself. Like, I think that's the most important part. I think a lot of people are like, oh, no, massage yourself. Like when you're washing your face, make that a face massage. Just take a couple, just a couple of minutes. Just like
Mhm.
really massage the oil in there and try to do the lines. And it helps. It really does help the blood flow to your face.
Especially
And
with
it
the
helps.
stone.
Yeah,
Hmm.
exactly. You don't even have to use a stone, just use your fingers, like, and get in there and just, yeah, and you'll feel like, you're like, oh, wow, my face is a little sore right here. I was like, you wonder why. And then even
Wow.
just like in the shower, I tell people just take a couple of extra seconds or minutes or, just take that care into what you're already doing every day and make that more, it's kind of like a mindfulness technique. Like be
Yeah.
aware, like of the care that you're putting lotion on, go ahead and just take that little extra
Rub it
care to like
in.
really rub it in. Yeah. And it makes it so much easier and your body will thank you for it. You'll
Oh my gosh. Well, first, I'm not a licensed massage therapist. I don't think I would be able to massage myself because I like to go to people and massage. And then my babe was like, every time I rub him raw. He's a massage therapist too. He's like, there's a way you do it. I was like, I am not trained to do this. I just do this.
well,
This is all
that's
I
why you
do.
start with yourself. You're your first patient. Like
Yeah. He's like, you
you
don't do
start
it
with
with love. I was
yourself.
like, I'm doing it with love. I'm just not doing it right, I guess. I don't know. Okay, so with people who are uncomfortable to be touched, how should, but they want a massage, they want to go get a massage, how should they look for a massage therapist, and how can they make themselves more comfortable when they're with a massage therapist?
So a lot of people think that when you come in, you have to like take off all your clothes. There's different, just, you don't have to take off all your clothes. You don't have to do what you see on TV. I know it's like a lot of people, I don't know. So I would probably, if I was uncomfortable, I would probably look for someone who does sports massage,
Mm-hmm.
because sports massage is usually going to be you're pretty much fully dressed and you're laying on the table. It's a lot of stretching and holding and stuff like that. I will also just communicate that the the therapist that you're not comfortable,
Yeah.
taking off your clothes and you don't really like to be touched, but you really need the work.
Mm-hmm.
And then that'll kind of take the awkwardness out of it because they'll know why you're responding to them that way. Sometimes we don't know that unless you tell us, because we're not mind readers. But we do have ways to accommodate you. But for the most part, when people come in, I don't ask for anyone to take off anything they're not comfortable taking off.
Mm-hmm.
um, that's actually illegal. I can't tell you to get naked and get on the table.
Oh, yeah, usually like, here's a
But
robe.
yeah, and legally we are not supposed to have you undraped. So you're supposed to be draped, and draping is just like taking a blanket and you're covered the whole entire time. So legally in the state of South Carolina and most other states, you have to be fully draped the whole time. And fully draped is no private parts or anything showing. Um, yeah, so yeah, and we use like towels and sheets and all that other stuff. So like it's really secure. You'd be like, huh, I feel like I'm wearing like some sort of adult diaper. How'd you do this with a sheet? I'm just like, I don't
That's good. Because I know when I had sent my mom to a massage therapist, she was uncomfortable when I came. She was like, "Mom, did you have a good time?" She's like, "It was okay." Where me, I'm like, "Okay, just take this off. Let's get on this table. I'm ready to get this out." Like, I love
yeah.
it. I'm just so free with it. But
Yeah,
I
so I would
understand how it could be uncomfortable, especially with someone like her age and she's not used to it. An older
yeah,
Black woman.
she might like to do like a Swedish massage. I would probably do something. And then you can also request a female therapist if that makes you more comfortable.
Hmm.
I think a lot of times people are so, and I see this all the time. People are so, the type of people who actually need massage are the people who are so accommodating. And they're so busy trying to make me comfortable. I was like, no, I'm here to make you comfortable. So whatever that is, within reason, of course, I'm here to do that. If you need more pillows, if you need more blankets, if you don't want to take your clothes off, we're here to have that discussion and get the body worked out. There's ways we can, do a massage without you having to take your clothes off.
Yeah. And then for the types of massage a person would get, let's say most people work like 9 to 5 sitting down. What type of massage, I guess, therapy would they get for that? Do you recommend?
So I love neuromuscular therapy, and that's more of we're going to work to improve your posture is the goal of the massage. And by improving your posture, you're going to see less pains, aches in general. So I would say neuromuscular. A lot of people say deep tissue, but I would like deep tissue doesn't always mean that the person that's doing it is taking into account this is how this is affecting the tilt of your spine and all these
Mm.
other medical things that go into it. They are just applying more pressure to a Swedish massage in some instances, not all. Um, I would probably say, yeah, just look for something neuromuscular. Deep tissue might be an option, but a lot of people say I just want a relaxing massage, but I was like, what's more relaxing than having less pain, less
Right.
than when you came in? So I usually do something that's relaxing, but also very healing. So yeah, I would say neuromuscular. Sitting is killing people. I know that sounds really like,
No, it's true.
but
It's
it's true.
true.
It's probably the worst type of thing that I'd rather people stand all day than to sit all day.
So a standing desk is better
Yeah,
than
you put a
sitting.
lot more pressure on your spine when you're sitting than when you're
Really?
standing. Yes.
Oh,
Yeah.
wow. I didn't know that. Okay, side question. So I believe I was getting a Swedish massage, and the massage therapist, she had her like her forearm on my
hmm
neck. Was that
hmm
proper?
Yeah, you can do that. It depends, but there's certain angles that I wouldn't do that in. Um,
It was a lot of pressure. It was a little scary,
yeah,
but I felt good at the same time. It's like, hope she just don't
no,
fall.
there's yeah. Most massage therapists know how much pressure to put on that area, and we're reading your body at the same time. What I'm feeling for when I'm working in the neck is the pulse. Like you can actually feel the pulse going through and underneath your like yeah, if you're paying attention. So if you're paying attention, you can actually feel your pulse going through the muscle and to, like through the arteries. So if you feel that, you just jump off.
Oh,
um,
wow.
it's not something that you can accidentally just like
Okay.
but yeah, it could cause a lot of pain if not
Right.
executed properly. So yeah.
Okay. I was wondering, it's like, was she about to kill me? But it's okay.
No, no,
It's okay.
it takes a lot more to kill.
I was like, oh
I'm not
my gosh.
gonna say
But
I know for
when she
sure.
was done, I was like, oh, it's so loose. But she was like doing the
Yeah.
whole body. And I always go like,
Sometimes I use my forearms and people think I'm applying a lot of pressure. I'm not. I'm just using that space to kind of use
mm,
you to stretch you. And sometimes it feels like we're using a lot of pressure and we're actually not. It's just that sometimes those areas are really bad. So it's kind of like a mixed bag when it comes to pressure versus and how much of it and where to apply it.
okay. That makes more sense because I was concerned where to apply it. I guess she is a licensed therapist, so she would know. I was just scared. Really scared. I guess my next question is, so I work out a lot and people who do exercise a lot, what massage therapy should they get?
I would say lean more towards a sports therapist. I feel like they'll be able, again, neuromuscular therapy is going to cover everything, I feel. And there's a couple of it depends on what kind of exercises you're doing. If you're more of a like a cross country runner, like endurance type of person, I feel like you need like those long flowy, like to loosen up the muscles and
Mm-hmm.
and get the blood flowing back to the body. And then I don't know. So it really depends on the kind of workout you're doing. I liked muscle scraping as well. That's that
What's
could be
that?
called. So muscle scraping is kind of what you guys see when people are using those tools on their face. Gua sha is what it's called a lot of times, but it's just using a tool, and what they do is they work the fascia tissue. So you're following like these lines and helping break up. So fascia tissue, so imagine you have your muscles, and then your muscles are held together and kind of like vacuum sealed it down and like taped down, and all that tape and holdings are called fascia tissue, and sometimes they get stuck together. So with the tool, you're actually just like scraping all of the gunk from in between the muscles
Mm.
and kind of like sliding it off. You can kind of actually feel it when as you're doing it. It's like scraping it off of the muscle. Literally what you're doing is gum
Ah,
scraping it. Yeah.
okay.
It sounds
That's
painful, but
it
it's
does.
amazing.
Is it painful?
It can be painful, but the results. I've had scraping down on my feet, for example, and the feet for me are very sensitive. It's just a sensitive area. But afterwards, I felt like I had new feet, and it's just like yeah, yeah. So that's like something I would recommend for like across like someone who's going to be like a marathon runner or something like that. Maybe go get some scraping done, get some cupping
Okay.
done. It's just kind of like pick your poison kind of thing. They'll all
Yeah.
kind of work. You just have to find the one that works for you.
Okay. So like I guess that includes heavy weightlifting too.
Yeah,
Okay.
yeah,
I was wondering.
yeah. So I would probably scrape those people.
Oh my gosh,
They
the
they
back.
usually prefer to be scraped. Yeah. I mean, it sounds bad, but it's really not as bad as it sounds.
Okay. And then yeah, I don't know. I'll try it because I'm
She's like, I don't
always
know. You
up.
said scrape.
So I don't know. Someone's scraping. I guess it'll be good to scrape the muscles when you're done. It's more relaxed and not as tensed. So then when I'm
Hmm.
exercising, it's like, why can't I move? Because
Yeah.
everything is so tensed. So that makes sense. Okay, so I went on your Instagram profile and I saw in your reels about something herbs. Can you tell me about that? Is that just like with tea or do you incorporate it in some of your practices, like in the lotions? And how do you do
Oh,
that?
yes. So in my oils are especially blended by a friend of mine. She uses a base of jojoba oil and a mixture of essential oils. So I have like a muscle blend that I use to help relax the muscles as I'm working on them. And then I also have a nerve blend that we use that helps people with like, um, I don't know, just a little bit of neuropathy, but also just like those over like the people who have like muscle spasms and things like that. So that nerve oil kind of works for both of those. And then just in general, I like to do like a little aromatherapy.
Hmm.
So yeah, I just like a mixed bag. But I personally, in my own life, love to use herbal medicine as opposed to your regular pharmaceuticals.
Go to the drugstore. Here's
Yes,
this medicine, but it'll make you feel this way. It'll fix this, but it'll cause this. So a long time down the road, you end up with cancer, but it's totally fine. Totally
right.
fine. Yeah. So, do you use CBD oil? I guess personally.
I haven't used CBD oil lately. Have used CBD oil, and I use it in massage as well. I like it a lot, depending on who I'm working on, because sometimes people come in and it's not necessarily like muscle, it's more stress, and then I feel like that helps with all of that as well. So
Okay.
yeah, and then sometimes people have like extreme pain, which CBD is really good for that too, and I feel like that helps the body regulate and reduce the amount of pain that they have. So I have used it in my oils. And then
Mm.
sublinguals are pretty good too to help people with anxiety. So
Oh, what's it
yeah.
called? Sublinguals?
So CBD comes in all these different forms. You can get like oils, you can get some that you ingest, you can get some that you rub on your body, you can get some, they come in all different types of forms.
Girl,
You
I
can get
know.
a
I use them all.
tea,
I
you
use
can
them
sprinkle
all.
it on your food. Um, but sublinguals are the ones that you put under your tongue. It's taking like a homeopathic herb. So what homeopathic herbs usually come in pellets. And this is a concentration of the oils from the plant. So think like essential oils, but they come in these little tiny pellets, and it's like a little Pez dispenser. Because you're not supposed to touch them because in this such this like pure form. So the oils from your finger will degrade the pellets. So you have to like put them in this little thing and then take it. So the sublingual is something
I'm
like
writing this
these,
down. Go ahead.
yeah, homeopathic herbs. And I do like a lot of homeopathic herbs as well. Like I love Arnica montana, which is a homeopathic herb that you can get, and it helps with muscle healing. So like if you're severely injured, what this herb does is it makes your body think you're a little bit more injured, so it heals faster. So it helps with swelling and bruising and all that type of stuff, muscle soreness. And just things like that. So the CBD sublingual is something like that. It doesn't come in a pellet form, but it does come in a liquid form, and you would place it under your tongue just like you would do a homeopathic herb, and then it works just the same. And I usually suggest that to people who have like really, really high anxiety, or sometimes people who have like depression. Those two like things where that are pretty obvious, and this is something that you can try before you get to like the higher end of the spectrum, which is like again pharmaceutical drugs. So it's like, let's start here, let's take baby steps before we before we get to here. It's a couple. Is usually usually
I
what I
completely
suggest.
understand. So I didn't know. I used to call it a tonic. I didn't know it's called sublinguals when you
Yeah,
put it
so
under.
yeah, I feel like so with the tonics or tinctures, I think where a lot of people are familiar with I think the process is different. So the sublinguals of the CBD is more of an oil, where the tonic I think is mixed with
A
kind of,
carrier, like MCT.
yeah. Well,
Yo,
the
I'm gonna jump on
carrier
this
for,
sublingual quick.
yeah, sublinguals are like oil carriers, and I want to say tonics have like a different type of carrier, which makes it, it's like oil in something else, or
Yeah,
maybe,
it's
or
usually MCT oil.
okay. And then I feel like with the tinctures, it's more of like a alcohol base, or like a
Yeah,
um, like a fermentation type process with,
yeah, it is a
well,
fermentation process. So the hill, well, I sell a hill salve, well, a salve called the hill salve, and I use a CBD isolate, it's one of the ingredients, and CBG inside of it, and I use it for muscle pain and for cramps, and so it
yeah,
definitely works.
that's the other thing I love it for. Like people who have severe cramps, which massage is a wonder for that too. People are like, "What? You can massage away cramps?" Yes, yes,
Oh,
I
can we talk
can.
about that? Let's talk about that next.
Yeah, so like a lot of people get menstrual cramps, and what I do is like a massage to help reduce that. Sometimes it goes completely away at that very moment, but there's a posture that people tend to have that causes cramps. So you
What's the
put what you're
posture? Okay, go ahead.
yeah, so basically what you're doing is you're putting like extra pressure on the uterus, and that can be through the feet, that can be through the hips, the tilting of the hips. And so the uterus doesn't have all that space it needs to function properly.
Mm-hmm.
I mean, you have to like pass eggs through like this little fallopian tube. So when there's not enough space for it to do that, it gets a little angry. Um,
I like
so,
that description and story. Mm-hmm.
so imagine if you have like this hip tilt, or if like your hips tucked in, like, okay, I'm gonna put this out here so you guys
Uh-huh.
can see it, get visual here. So if you have like a slight hip tilt like this, I've noticed that if I ask people, I was like, does it hurt every period? They're like, no, like almost like every other period. So obviously the fallopian tube on this side doesn't have as much space. So what we do is we open up this side of the leg.
Mm-hmm.
Um, some people have just like pain all across. That's usually it's just like a pelvic tilt.
Yeah.
And then again, they have points in your feet and in your wrists, to where after so many years, I'll like literally feel somebody's wrist. And I'm like, you had a hysterectomy, didn't you? It's like, yeah, how'd you know? Like, because I can tell by your wrist. Yeah,
Really?
yeah,
You can tell by the wrist?
hmm,
Oh, wow. That's
yeah,
craziness.
yeah.
Okay. Okay, well, I know our time is almost out. I do have two more questions. So one is, what is your favorite tea?
Okay.
What
That's
favorite
so.
herbs? 'Cause I like tea. I like using CBD tea and French lavender. But what is your favorite tea?
Okay. Oh gosh, that's such a hard one. I'm gonna say, this is really weird. I'm like a tea buff, so it's called Premier,
Uh-huh.
and the tea has bergamot in it,
I've
and I
heard
don't
that.
know why, but it's so calming, and it's like a black kind of tea, but it's by this Indian tea company called Kusmi. Um,
Kusumi.
yeah,
Writing it down.
and then this particular blend is one of many, and it's called Prince Vladimir. And I know it's really really random, but that's my favorite tea.
Okay. Prince Vladimir Kusumi.
Vladimir by
Oh, I think
Kusmi.
Earth Fare sells Kusumi. I think
Yeah,
they
I
do.
think they do. Yeah, because I used to get it from Southern Seasons,
Mm-hmm.
but then we don't have it. We don't have that grocery store that gourmet. Of course, we don't have a gourmet grocery store anymore.
Nope.
So yeah, I'm pretty sure Earth Fare would have that. Yeah.
Okay. And then the last question is, what is your facial care routine?
Um, that's a lot.
Go ahead. I have a lot of steps too. Just choose. We can choose something simple. It could be like wash, moisturizer. Mine's is like wash, serum, 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 toner, moisturizer.
Yeah, that's more like that. I was like, oh gosh, it's so what time of day is the question?
Morning.
In the
Let's do
morning.
morning.
Okay, in the morning it's wash, um, which my wash is also a mask, so I let it sit for like 2 minutes while I brush my teeth, rinse, and then I do toner with Fenty, Rihanna's toner, and then I also do her what you call it, her moisturizer, her sunscreen moisturizer combination, but I don't do her under eye cream. I started
Mm.
using Nourish Max, so I use those, and then that's it. That's it for the for me, and I'm out the door. I guess it wasn't that long. It
That
seems like a
wasn't that
lot.
long.
I was
And
like,
you
it
said
seems,
sunscreen too, right? You said sunscreen.
yeah, it's like uh, a sunscreen moisturizer combination, but it's because I don't like the smell of sunscreen. Is that weird? I don't like the
No,
way it
because
smells.
sunscreen can smell really strong. I use Goop, and so it doesn't
Okay,
have a weird smell,
it
but
doesn't
sunscreen
smell.
can smell bad.
I hate like regular like copper tones smelling. Yeah, I don't like that smell. It's like they all have it, but I think the only ones I found that don't are like the Sunbum, and then there's this other brand, but it's like it's called Hyaluronia. That one
Hallelujah.
doesn't smell like any. I was like, oh my gosh, this is like berries. I used to use that, but then I like the way this one smells because it actually has a smell, which I was like,
You're
probably
a
should.
scent person. That's okay.
Yeah, I'm a scent whore.
Some people are textures. My friends don't like wet stuff. I was like, really? She's like, I like chicken salad because it's wet. I was like, okay. I can't eat watermelon, it makes me nauseous. So hey, we're all
I
interesting.
like textures. But I can't. I like smells. Like if it smells weird, I can't.
Okay. Well, thank you for joining. Everyone who's watching, follow Gabby. Her link to her practice is on her profile page. Do a search
Ah,
with her. Yes, I looked. And then so follow Gabby, follow Sheepology. And thank you, Gabby, for taking the time out to interview with me. I know your life
oh,
is
thank
busy. It's
you.
called real
No,
life, and
I'm
that is
sorry.
fine.
I'm sorry for being so late.
Mom
I'm
and
so
Dad are starting
sorry.
to become a kid. It's
Ah,
okay. All right, well, thank you.
thank you. Bye.
Bye. And now.